Hi there. Welcome to Doc Talk. Doc Talk is the podcast that is put out by the Knoxville Academy of Medicine, which talks about health issues in plain language so that we all know a little bit more about medicine and what our doctor's talking about when we go and visit him in the office. I'm Elise Denaney, former president of the Knoxville Academy of Medicine, and I am so happy to welcome with us today Dr. Afshin Skiba. Did I pronounce that wrong?
Yeah, it's Afshin Skiba.
Afshin, thank you. So Dr. Skiba is a vascular surgeon with Premier Surgical Associates. And first of all, what's a vascular surgeon?
So a vascular surgeon is someone who fixes blood vessels, basically any blood vessel in the body other than the heart and the brain, which are fixed by heart specialists and brain specialists.
Okay, so vessels in the body. I'm thinking vessels in the body. So that would be arteries and veins, principally.
Exactly, yeah. Basically, all of the pipes that bring blood from the heart to our intestines and our legs, and then from those things back up to the heart, where it forms a circuit.
You're the master plumber.
Yes, we are called plumbers too.
All right, so we're going to talk about a syndrome called chronic venous insufficiency, now that we know what vascular surgeons do. So chronic venous insufficiency. Can you explain what that is?
Yes.
Thanks.
So for veins, as we mentioned a minute ago, veins bring blood from our legs back up to our heart. And so anything that interrupts that process of blood normally getting back from the legs up to the heart can cause higher pressure in the veins, and that results in this chronic venous insufficiency. So there are multiple different causes, and it's easy to categorize them into three separate buckets, if you will. The highest up and the ones that cause the most trouble are outflow obstructions. Those are things in the abdomen and the pelvis where the vein is compressed or even completely blocked. You have issues with the veins of the legs themselves where something with the vein is what's called incompetent. It's usually one of two things, either the valves of the veins or the perforator veins. And let me explain what those things are. So veins, because there are these tubes, these pipes, as you said, that are very thin-walled, in order for blood to get back up to the heart, we have to be walking around, and the muscles of the legs, as they contract, bring that blood back up. But when you're standing up, gravity tries to pull it all back down. And so there are these wonderful things inside the veins called valves that will close when gravity is trying to pull it backwards. But if they don't close properly, then that will cause venous insufficiency. Again, blood going backwards, going the wrong way.
Oh, it's like canal locks, like the Panama Canal.
Right, exactly. That's exactly right. Or if you think about like a ratchet on a car that's only supposed to go one way.
Right.
But if it's going the wrong way, then that's a problem. The perforator veins, those are the veins that connect the veins that are close to the skin to the veins that are deep, closer to the bone. So there are two venous systems in the leg. The superficial ones, those are the ones close to the skin. The ones deeper down by the bones, those are called the deep veins. And these perforator veins perforate certain connective tissues in the leg to connect the two of them, hence the name perforator veins. And if they don't function properly, they will again allow blood to go backwards, down back into the legs, causing this issue of venous insufficiency. So those are the two main issues, the valves and those perforator veins. And the last thing, which is unfortunately still a common problem, there's this thing called DVTs. And DVT stands for deep vein thrombosis. So what does that mean? That's a blood clot in those deep veins, the veins that are closer to the bones, those big veins. And when you have a blood clot in there, there are a lot of things that we can do to fix that stuff. But even if you get a good result and you remove a lot of that blood clot, still there's always a thin rim of the blood clot that remains on the inside of that vein. And when that scars down, which happens after about 3 to 4 weeks, the valves that we mentioned a few minutes ago, those will never close properly again. And so that causes venous insufficiency because even though the blood clot is gone, the valves don't work right and allows blood to go backwards in the vein. And that plus, we can't always get the blood clot out. And so sometimes, even though the blood clot has been cleaned up with certain types of medicines that we give, or we can mechanically remove it sometimes as well, what remains scars down. And so you had a wide open pipe that now is partially blocked with this scar. And so for those two reasons, these DVTs, the blood clots in the veins, contribute long-term to this issue of venous insufficiency.
That's fascinating. I mean, the human body is not so different than plumbing and galvanized. It's just
That's true.
it's
That's
just
true.
mechanics. I mean, so you mentioned outflow.
Yeah.
So like when a woman gets pregnant and she's got this baby inside of her, that puts a lot of pressure in her stomach, and then so the veins that are down in the legs can't get it past the baby back up.
You're absolutely right. You're absolutely right. That so to mention the risk factors, that is actually one of them. So smoking is a risk factor. Being a little overweight is a risk factor. There are certain, thankfully, uncommon genetic issues that can contribute. But the hormones, we don't really know exactly why, but the hormones related with puberty, pregnancy, and then the supplemental hormones that women get after menopause, that all of those contribute to the formation of varicose veins, to the point that varicose veins are about 4 times more common in women, particularly women who have had multiple pregnancies, as compared to men. So that is a major risk factor.
So is varicose veins, if you have varicose veins, then you probably have chronic venous insufficiency?
By and large, yes. The vast majority have some underlying issue with venous insufficiency that requires treatment, because if you fix that, then the majority of the varicose veins will involute and just go away on their own. So in other words, if you fix the outflow obstruction or the vein that's allowing blood to go backwards, then a lot of those varicose veins just go away. You don't even need to fix it. Not true in everybody, but true in many.
Okay. All right. So kind of understand it. There's so much more I'd like to ask you about it, but I'll go on because we don't have all that time. Maybe do another one. Okay. So if we have chronic venous insufficiency, how do we know? Does my legs swell up? Does it itch?
Yeah, that's a great question. Usually not itching, but the symptoms run a very wide range. So in the most severe of circumstances, let's say someone has had a filter put in their vena cava, which is the main vein in the belly, where all the blood from the legs drain through that. If that gets plugged up with scar or blood clot, then people can have massive swelling of their legs and even wounds. They're called chronic venous ulcers. And all that means is it's an open wound, usually just around the ankle or above the ankle. And these wounds and swelling can be very severe. And so that's the worst of circumstances. Thankfully, most people don't have that. If you go kind of one notch more mild from there, where you have the more garden variety venous insufficiency, where the veins closer to the skin, the superficial veins, are allowing blood to go backwards, those usually just result in varicose veins. And when people have varicose veins, sometimes it's really just a cosmetic issue, but for a lot of people, when they're standing for long periods of time, and that, by the way, is another risk factor, professions where people stand for extended periods, nurses, we have a lot of nurses that come to our office, people like cashiers, where, again, you're standing in one place for an extended period of time. That contributes to the formation of these vein issues. And so the burning, swelling, and kind of heaviness, a feeling of heaviness in the legs is very common in people who have varicose veins. And then in the most mild of symptoms, people have what are called telangiectasias or reticular veins, or more commonly known as spider veins. And so that is the most mild manifestation of this broad spectrum of issues. So you can have, the worst is swelling and wounds. The much more common in the middle are just, garden variety varicose veins. And then again, the most mild are just these spider veins.
So if I have that and I see it and it doesn't cause a lot of problems, but should I get it checked out?
Well, it really is dependent on how much it's bothering you, because we see people come to the office all the time with these types of things. And occasionally people come and they say, well, I just wanted to get it checked out. And we're happy to evaluate that. But if it's not causing any pain or discomfort, or it's not a cosmetic issue, then there's really no reason to fix it. Like they say, if it ain't broke, don't fix it. So if it's not causing issues, then, no reason to do unnecessary procedures and unnecessary things if it's not causing them trouble.
Okay. So we do like to wear our shorts during the summertime.
Yes.
And we do like to look nice. We don't want to offend anybody.
Naturally.
Right. So we do want it addressed. And so some of them say, well, I had my veins stripped.
Yeah.
What does that mean?
That's a great question. So thankfully, the need for vein stripping is,
Gone.
it's basically been completely replaced with what are called percutaneous techniques. And all that means is needle stick procedures. It used to be to treat these veins of the legs, the superficial veins, the ones closer to the skin, that are having blood going backwards in them, that are refluxing, causing this insufficiency. You'd have to literally rip the vein out of the body, but that is no longer needed. With our various needle stick procedures, we can put special catheters up into the vein that will shut that vein down so that blood no longer flows through it. And so any of the varicose veins or spider veins that would have been fed from that vein that's allowing blood to go backwards then will mostly just go away on their own once you fix that. Again, not true for all of them, but true for most.
That's brilliant.
Yeah.
That is such good news. Can that be a day procedure?
Absolutely, absolutely. So since we're talking about treatments, let me go through just quickly what is involved in treating these. So if someone has, just for example, the garden variety varicose veins, the initial treatment is elevation and compression. And so that doesn't involve a procedure of any kind, because there are some people out there that if they just do a good job keeping their legs elevated when they're not moving around and wearing what are called compression stockings, then that, for some, is all that they need. And compression stockings are basically like a fancy kind of pantyhose that is very thick and stiff that really compresses the leg to help replace the issue that was caused by the incompetence of the valves or perforators that we mentioned earlier.
They're not bad either. I mean, I know a lot of friends who are athletes, and they use compression socks.
Right.
Yeah.
Right. And so there are certainly people out there that tolerate wearing them. In order for them to be truly effective, you have to pretty much wear them at all times except for when you're sleeping and showering. So what we find is actually fairly frequent. Even after people have had a multiple month trial of elevation and compression stockings, we of course advise them to stop smoking if they're smokers or try to lose a little weight if that's contributing. A lot of people say, well, doc, you know, I've tried this, you know, it's really hot during the summer to wear these and it's really uncomfortable because they are very, they're very tight. Some people find them very difficult just to get them on. And so for a lot of these folks, we end up fixing the veins, which, and that's the final step, are these needle stick or percutaneous procedures that replaced the vein stripping in the past. And what that involves, it's just a needle stick procedure, which usually is just one treatment, as we talked about, by shutting the vein down on the inside. There's a percentage of people that even when you shut that down, because their burden of varicose veins is so large that even when you've shut down that feeding vein, that there still may be a couple of varicose veins that don't go away in the long run. And so a few months down the road, then we may end up removing those with something called a microstab phlebectomy. And all that means is through basically just another tiny poke hole, you physically remove that little varicose vein. But each of these are day procedures. We just ask that someone drive into the office and drive out, that so that, in other words, they have a driver, because we give them a couple of pills that make them a little more comfortable for the procedure, where they can't drive when they're taking those pills. It'd be like driving if you'd had a beer. But that's pretty much it. The downtime is just a day or two afterwards. It's not things where you have major surgery, you have major incisions where you're out of work for weeks and weeks. This is just talking just a day or two.
That's amazing. Yeah, I can imagine that sometimes. Like I remember from high school pictures and things, or even like on the internet sometimes, when you look at an image of the vessels that feed your leg, they have that, looks like an inverted tree, you know, where you've got all these little branches.
Right.
Yeah.
That's
so
exactly right.
yeah. So sometimes it's hard to get every branch.
Right. Right. And thankfully, though, the majority really just need one procedure just to shut down that feeding vein. But again, there is a percentage in the neighborhood of a quarter or a third that have a lot of varicose veins, these branches, as you mentioned, that even though most of them involute after you shut down that feeding vein, there are still a couple that maybe cause some burning or other issues that will, like I said, it's just another day procedure where people come in and they leave the same day and they can go back to work the very next day if they want.
So, risk of doing it?
So there is the standard risk that you would associate with any procedure where you're doing something that breaks the skin, and that is bleeding and infection. There is a small risk with certain types of foam procedures that some of that can go to the lungs and cause an issue with the lungs. It's extremely rare. And the way that our practice is set up, since we use special catheters that don't involve that kind of foam, that risk is kind of off the table. So really the risk is just very minimal. We give medicines too, of course, numbing medicines and things like that, and there's always a possibility that someone could have a little bit of a reaction to a medicine. But
Sure.
again, that's true with any kind of
Right.
medicine. So the risks are very minimal for these needle stick procedures.
Okay, and then after that, do I still have to wear my support hose?
We recommend for a couple weeks afterwards. That's a
Okay.
great question, because again, a lot of the people that end up wanting these done want to be able just to get rid of those support hose, the compression stockings. And it's not necessary to wear them for a couple weeks afterwards, but we recommend it because there's always a little bit of bruising that results of the procedure. And if you have nice compression on there for a couple weeks, that minimizes the bruising and therefore the recovery time.
Good, yeah. It's very hard. Makeup doesn't cover bruises, I know. It's just really, really hard. Okay, so I'm going to backtrack a little bit.
Yeah.
Prevention.
Yes.
If I am a person who has to stand all the time,
Yeah.
you mentioned activating those muscles, which will squeeze the vein
Yes.
and get that blood out of there. So
Yes.
walking around
Yeah.
at any job is probably a good thing.
Yes, yes. And we have really no way of knowing how much that helps, because a lot of people that develop these vein issues, it may be that just their veins aren't as strong as other people's veins and they're a little bit genetically predisposed to it. But you're absolutely right that for people that are in professions that involve a lot of spending time on your feet, particularly ones where you're standing in one spot, moving around a little bit really helps. And people also will prophylactically wear compression stockings if they're in that kind of profession. We know a lot of nurses, for example, that say that they feel a lot better when they're wearing their compression stockings at work because they know they're going to spend 8 hours on their feet, and that will help. Okay. Whether or not that long term will prevent it from eventually still happening, hard to say, but a lot of people do find that making sure that we're moving around in the middle of the day, and for some people even wearing compression stockings can help.
Okay. One last question?
Yeah.
Okay, so chronic venous insufficiency, sometimes it's important to know whether or not you have it because it could be a sign that something else is going on. I know restless leg syndrome is out there all the time, and sometimes restless leg syndrome, they just treat it with medication, which is great, but sometimes restless leg syndrome is from a chronic venous insufficiency, and if we took care of that, wouldn't have to take medicine.
Yes. That is potentially helpful. That said, restless leg syndrome is one of those issues that there's no great treatment for it, unfortunately.
Right.
And if there is a cause that you can nail down, being something like chronic venous insufficiency, where the blood is not getting back up to the heart properly, those are mostly very easily fixed. And I think if we had to kind of mention two take-home messages from this, number one, that as we mentioned a minute ago, the procedures themselves, since they're all needle stick procedures by and large, the downtime is just a day or two, and the procedures themselves are very minor. They don't really cause a lot of pain and discomfort. And I think another take-home message, since we're talking about other blood vessel issues, is that chronic venous insufficiency, whether it comes to small spider veins in the legs or major outflow obstructions, they are very best treated by a fellowship-trained vascular surgeon. And the reason why is that if you imagine a house that has a crack in the wall, if you have your painter come in and fix the crack, it'll keep coming back because the foundation hasn't been fixed. And the same is true with venous trouble, that if, for example, using that same analogy, we have an outflow obstruction, we could fool around with varicose veins time and time again, and people get, unfortunately, a lot of unnecessary procedures when that happens, when if the outflow obstruction were to be fixed, then all of that would just go away on its own. So it's really important to have someone who can fix the entire spectrum of vein issues to evaluate someone who has this type of vein trouble.
I love the fact that you use the building analogy because it's so true. I mean, how many of us have been in a situation where somebody who's very nice and very, very good comes and fixes this little problem, but doesn't have the experience or the training to recognize that something deeper is going on. And if we don't take care of that root cause, or like they could be having a malignancy inside of their abdomen and not recognize it. And to miss that would be unfortunate.
Yeah, absolutely.
Yeah.
Absolutely.
There is so much more about chronic venous insufficiency that we haven't even talked about. So maybe we're going to have to do a second one. Afshin, how would people get a hold of you if they need to know more?
Yeah, so our office is at 6408 Paper Mill Drive. So that is right next to the Holiday Inn Express off of Paper Mill. Anyone can call for an appointment anytime.
The new one.
I'm sorry?
The new Holiday
Yes,
Inn.
yes, the new Holiday Inn Express. Yes, that's correct. And our main number is 865-588-8229, and we'd be happy to help any way that we can.
Oh, it's been such a pleasure having you join us together to talk about chronic venous insufficiency today. Again, this is Dr. Afshin Skiba with the Premier Surgical Associates, and that's a wrap.